Hi everybody, welcome to another video. Now, I am doing this video to address an issue regarding medication administration that has been happening since about a year and a half now, and I am tired of responding to the same question over and over again and having my students like do this battle with this belief or this interpretation of medication administration. And it has to do with when the second check is supposed to be done. The general guideline or checklist that has been sent to schools dictates that the second check is supposed to be done after the medication has been calculated and dispensed. However, many, or maybe not many, but at least a few persons believe that this is incorrect, and the second check of medication administration process should take place during the calculation and dispensing of the medication, or the calculation and dispensing of the medication is part of the second check. Fine. Now, the issue I'm having with this is that the emphasis is not being placed on whether or not 3 checks are being done and 3 checks are being done at appropriate times. The emphasis is being placed on when the students say they're doing the second check, not necessarily on what the students are doing. So if a student does the first check, then proceeds into calculating and dispensing the drug, and then say, I am going into my second check, there's a big issue with that. Versus a student who completes the first check, then says, I'm going into my second check, then does the calculation and the dispensing and carries on. If you notice, both the processes are the same. It's just a matter of when the student says that they're starting or proceeding with their second check. That has been the issue. Now, according to this source, Clinical Nursing Skills, Basic to Advanced Skills by Sandra Smith, Donna Duell, and Barbara Martin, they actually say that the process begins with an extensive verification process, and then the nurse retrieves medication to be given and compare drug label with MAR. The nurse then inspects label to ensure that medication is indicated for ordered route of administration. Then they say, determine if any calculation is necessary to prepare the correct dosage. Calculate client's dosage based on strength of medication if indicated. Prepare medication as indicated for non-parenteral or parenteral route, checking drug label before, during, and after preparation. In this text, the words first check, second check, and third check are not utilized. Only the processes step by step are outlined. So the emphasis on first check, second check, and third check isn't there. This same text summarizes when the labels are supposed to be checked. So they say, remember to check the label 3 times. When taking the medication container from storage, when placing medication into medication cup, when returning medication container to storage place. On the other hand, in the work derived from Clinical Procedures for Safer Patient Care, National Center for Biotechnology Information states that a second check should be performed after the medication is removed from the dispensing machine or medication cart. This step should be performed prior to pouring or removing from a multi-dose container. According to Taylor's Handbook of Clinical Nursing Skills by Pamela Lynn, the first check is done when the CMR, the CMAR/MAR is read and the proper medication is selected. Then the instruction is to compare the label with the CMAR/MAR, check expiration dates, and perform calculations if necessary. This is the second check according to this text. But here is also what I find interesting. According to Pamela Lynn, when all medications for one patient have been prepared, recheck the labels with the CMAR/MAR before taking the medications to the patient. Replace any multi-dose containers in the patient's drawer or unit stock. Lock the medication cart before leaving it. This is the third check. This check is done to ensure accuracy and prevent errors. So this third check, according to Pamela Lynn, is not done at the patient's bedside. It's done in the area where the medication is prepared or taken from the medication cart. If it's a medication cart that can be transported, then if it's at the patient's bedside, then the third check is done there. Now, the point of all of this is to show how different sources will define the checks and explain when the checks are supposed to happen. The persons who would prefer for the second check to be done while you're calculating and dispensing, or prefer for you to refer to the calculation and dispensing as part of your second check, they might have a source that's guiding how they teach you. But the issue is the sources differ, and if the sources differ, then we have to just focus on what the main principles are, which are that a verification must be done, a first check must be done, calculating and dispensing must be done, a second check must be done, a third check must be done, 3 checks must be done before, during, and after dispensing. I hope this helps.